Good afternoon. Welcome and thank you for joining us today. I'm Akilah Cannon, a consultant for CAVSA, and I'll be moderating today's webinar. A few administrative items before we begin. We'll be taking questions through the Q&A feature after each panel concludes. Please submit your questions there. Next, I'd like to introduce CAVSA President Steve Peck. Steve served as a Marine officer in Vietnam and is the CEO of U.S.VETS, the nation's largest nonprofit provider of housing and other essential services for at-risk and homeless veterans and their families. Steve has been with U.S.VETS for over 25 years. Steve, thanks for being here today.
Thank you, Kayla, and welcome everyone. As Kayla said, I'm also the president of CAVSA, the California Association of Veterans Service Agencies. We have been advocating for California's veterans since 1995. Starting then, we were really working on workforce issues. We all know how important it is for veterans, and particularly homeless veterans, to find employment so that they can house themselves and support their families. Lately, we have, since then, we have also advocated for the VHHP, Veterans Homeless and Housing Prevention Program, and that program offered $600 million to build veteran housing. Over 5,000 units were built with that housing. And the key to that was CAVSA advocated very strongly that mental health services be provided with that housing. We now have another opportunity with Proposition 1. Proposition 1 is a $6 billion bond. $1 billion of that is devoted to housing for veterans. At this moment, there is no mental health or case management services linked to that housing. So we feel that is very, very important. We all know that we are serving a very vulnerable population who will need that case management, need those mental health services. So what we are going to be doing in coming months and talking about today is how important that is to stabilize the veterans that we're going to be able to house in this housing. Kayla, I'm going to give it back to you.
Thanks, Steve. All right, so our panels today, I'll briefly introduce our speakers today. So panel 1, how Proposition 1 can respond to the mental health needs of veterans. We have Toby Ewing, the Executive Director for the Mental Health Services Oversight and Accountability Commission, Akilah Templeton, the President and CEO of Veterans Village of San Diego, and Robert Stohr, the Executive Director at U.S.VETS. For panel 2, Proposition 1, Impact on Veteran Housing, we have Amy Fairweather, Director of Policy at Swords to Plowshares, and Chris Johnson, President and CEO of Nation's Finest. All right, Toby, I'm going to pass it off to you to start panel 1.
First, I want to thank CAVSA for allowing me to join you today for this conversation. On behalf of what is now the Mental Health Services Oversight and Accountability Commission, that's being renamed as the Behavioral Health Commission, we really appreciate that you are pulling this together and creating opportunities for us to share some of the work that's underway and to engage a broad audience in understanding what's happening with Prop 1 and how we can actually ensure that this reform has the impacts that the governor and the legislature are working towards and that we need for Californians in general and for California veterans specifically. So just thank you for the chance to be here. I want to talk a little bit about some expectations and opportunities. The Mental Health Services Act, and now renamed the Behavioral Health Services Act, really set up this important vision that is unique in this country. And as the governor pointed out in his press conference in signing the legislation that put Prop 1 on the ballot, and he's consistently highlighted, is we have not been able to achieve all of the goals that we need to achieve for Californians. And Prop 1 creates some new opportunities. It's part of a broad set of reforms that the administration is promoting in terms of how we access federal funding, the kinds of services are available, and the commitments that we're making are for services that includes mental health, substance use disorder treatment services, and also the oh so important housing issue. And so, I really appreciate some of the comments that we're going to hear later today in terms of the need to make sure that services go along with housing and other supports, because that's part of the language of the new law. But there really are a handful of opportunities that the state of California is pursuing over the next 6, 12, and 18 months that it will be essential that veterans organizations, including CAVSA and all of your partners, have a seat at the table to make sure we get it right. The biggest one is community engagement. The state is reinforcing expectations that state funding and local government funding be committed to programs that are shaped through a community consultation process. And so the funds that the commission provides to community organizations to be available, to be vocal, to be loud and explicit about what is necessary is essential. And so really are asking all community organizations that are interested in improving how we serve veterans to share your voice, right? To work with CAVSA or other community organizations to be explicit. We're very excited about California's new commitment to prevention, and we see that as the most promising opportunity, but we also recognize we don't have a shared agreement of what prevention means in the behavioral health space, so we have a lot of work to do. And if we're going to make sure that the state's prevention strategy is responsive to the needs of veterans and their families, then we need to make sure that we understand what that can mean in terms of supporting those families to be successful. And that includes ensuring that children are succeeding in school and people with mental health needs are succeeding in work and housing, avoiding the criminal justice system, and so forth. The state is making major investments in workforce. We're working with other state agencies to ensure that our workforce strategies actually reflect the population that we're serving. And so that means we need to ask pointed questions about how we can bring more veterans families, more people who understand the culture of the veterans community into the state's behavioral health workforce, so that not only can we improve services for the people that are walking through our doors, but we can improve how we design programs and policies and practices by taking into consideration the valued input of the people with lived experience, in this instance, military experience. Early intervention, housing, full service partnerships, accountability strategies. The Health and Human Services Agency is beginning to talk about the accountability requirements of Prop 1. That will probably take a couple of years, but we're working closely with them to understand how we can be persistent in understanding the alignment between the services that are available and the needs of Californians. And so one of our goals is to ensure that the accountability system is reflective of the unique needs of veterans and their families. And I really want to highlight that. Is sometimes we sort of get stuck in our little boxes, but we want to recognize that we have to meet people where they are and understand the cultural systems and the support systems they're in. And it doesn't always mean an extended family or an immediate family, but it often can. And so for the commission, the key to success for Prop 1 is that we are persistent in our ability to listen and learn from the communities we're serving, from our partners in local government, from our partners in the community-based organization space, the third sector space, that we're really persistent in terms of the kind of data we have, the research, the curiosity about what's working and what's not. And we're willing to recognize that some of the things that we're doing aren't working and that we need to be creative and innovative and rethink our strategies. We're very excited about Prop 1 and what it means for California's behavioral health system in terms of the new opportunities to invest in workforce, prevention, early intervention. We're very excited about the housing opportunity. We recognize that there are challenges to make sure that funds that are going into infrastructure building, into building houses or remodeling or purchasing, are aligned with services, because we recognize that housing without services has not worked as effectively as we need it to. We're also very excited about identifying new financing strategies, new strategies for public assessments around the impact that we're having, so that we can identify innovations that can really improve the type of service delivery that we provide to the people that we're serving. So it's very early in this process. Prop 1 recently passed. There's lots of planning that's happening at the state level. We're working with our local partners to support planning at the local level as well, including using the balance of Mental Health Services Act innovation funding to support the transition to the Behavioral Health Services Act, and really working to leverage local funds, state funds, federal funds, and even private sector funding to ensure that we're able to be more responsive under Prop 1 than we were able to under the Mental Health Services Act. We're cheerleading every day on this with this persistent attention on making sure that the community priorities, community needs are what are driving the decisions that we're making. Look forward to ongoing conversations with CAVSA and your members and veterans organizations to make sure that the kinds of decisions that are made over the next 12 or 18 months will result in the impacts and outcomes that the governor and the legislature are looking for in terms of ensuring improved well-being for veterans and their families and our communities at large, or I said writ large. Thank you again for the chance to join you. I'm going to hand it over to Akilah, and I'm hoping that we have some chance for questions towards the end of the panel. Thank you.
Thank you so much, Toby. That was very encouraging. Thank you. Pleasure to be here. For a few years now, we have witnessed a serious attempt, to Toby's point, to overhaul the mental health system here in California. In a lot of ways, this is happening in response to a few things. So increasing rates of homelessness, a growing mental health crisis, and the reality that people living on the street are the most vulnerable, those who are suffering with severe mental illness in a lot of cases. Finding the balance between responding humanely so that we are giving people what they need in the way of housing and clinical support, but then also ensuring that people maintain their civil liberties and a sense of self-agency has made it a little challenging to get to this point, where at least now there is legislation on the books that can help us to move the needle a bit. So with the passage of care court legislation, amendments to the Lanterman Act, the implementation of CalAIM, and now Proposition 1, there are definitely more tools in the toolbox, and I would say that that is pretty encouraging for service providers. But what does it mean for service providers? Specifically, and for the sake of our conversation, veteran service providers. How do we ensure that veterans are not left behind when we are building out new programs and services? There is a general belief at the local level that veterans receive the majority of their support from the federal government, the VA healthcare system, the Department of Veteran Affairs. And while this is in large part true, the help that is coming from the federal government is not always enough to meet the actual need. It is not enough to meet the need in a state like California, where there is a higher cost of living, there's a shortage of clinicians, and where we are home to a third of the country's homeless veteran population. There are more than 10,000 homeless veterans living in California, and there are many more who are at risk of becoming homeless. So in California, we have an obligation to take care of our own. Veterans who are residents of California, in our opinion, deserve culturally competent care or programs that are designed to fit their unique set of needs and circumstances. And so I really appreciate Toby talking about the state's desire to do that. Moreover, it is imperative that as we work to expand and develop these programs using Prop 1 funds, that we deliberately and intentionally set aside a portion of that funding for veterans. We also need to identify a clear path for community-based organizations to access these funds. Historically, counties have had a lot of flexibility when deciding how to use money from the Mental Health Services Act. For community-based organizations, accessing MHSA funds typically involves contracting with the county to provide these services, and that's not always an easy process. Many veteran service providers have had difficulty accessing those funds. Oftentimes, as veteran service providers, we hear that we should be tapping into some of the sources that I mentioned earlier, so CalAIM and Medi-Cal and some of the other funding sources that are out there. This can sometimes be problematic for veteran service organizations because tapping into these various funding streams comes with the caveat that we must serve everybody and not just veterans. Veteran service organizations understand the importance of culturally competent care. We know that our programs work, but if we can't provide those services and target them to veterans, we risk losing some of the gains that we've made over the past decade. We risk mission creep and losing the opportunity to actually operate in our gift. And so it is very important that veteran service organizations have the option to provide care to a targeted population. I know that there has been some concern that Prop 1 is shifting dollars away from mental health services in favor of more housing and supportive services. But we think that we can think about this in a different way. We should keep in mind that many of these resources are geared towards people with mental illness and severe mental illness, and they can still contribute to overall well-being when we consider the social determinants of health and mental health. So things like economic stability, neighborhood and environment, and community connection and support. Across California, community-based organizations are coming up with innovative solutions to meet the needs of Californians. This is true at Veterans Village of San Diego, where in addition to our housing and substance abuse treatment programs, we've partnered with the Cohen Veterans Network to now operate 3 outpatient community-based mental health clinics to serve veterans and their families, as Toby mentioned earlier. These clinics are privately funded, but they shouldn't be. We do this work to close the gap and not to replace the services that are already available. For several years now, our clinics have attempted to solve the problem of long wait times for mental health appointments and the need for more high quality mental health care options that are available to veterans and their families. At Veterans Village of San Diego, we realize that veterans are not as homogenous as people think. And so we know that we have a ways to go before we can adequately address the mental health needs of all veterans, which can range from intensive services and treatment like that offered in some of our residential programs to the more mild to moderate outpatient treatment that we offer through our Cohen clinics. The hope is that Prop 1 will provide more of an opportunity for us to partner with the state and the county to get this work done. And with that, I'll pass it over to Robert Stohr from U.S.VETS.
Thank you, Akilah. Always a pleasure to see you and to hear the knowledge that you're able to share. So I currently am the executive director at U.S.VETS Patriotic Hall, and we are specializing in innovative programs for mental health, for prevention and early intervention. Part of my background was serving the Suicide Prevention Center for Los Angeles and Orange County. And over 10 years ago was when I became acutely aware of the crisis in our veteran population, which inspired me to come to U.S.VETS Patriotic Hall. Next slide. So what I want to share to you today is a little bit about what our history is, our programs, our impact. And part of this was funded by MHSOAC dollars, and now we are in need of additional funds as a result of that. Next slide. So the important thing about understanding our history is U.S.VETS has over 12 residential facilities, well, 12 sites that have over 34 residential facilities. I am the only site in downtown Los Angeles, next slide, that does not have a residential facility attached. And that's was intentional in the sense that I'm in downtown Bob Hope Patriotic Hall, once the 10-story building, once the tallest building in Los Angeles. It is here where we partner with the Department of Military and Veterans Affairs to provide a one-stop service center for veterans. In 2015, we received a grant from a private endowment to open up in Orange County, and now we're at the Goodwill Tierney Center in Orange County, and we're duplicating our efforts there to become a one-stop service center. But the focus is on mental health, and the Bob and Dolores Hope Foundation, as well as other endowments and foundations, have been key to the support of maintaining the programs. Next slide. Let me talk to you a little bit about the programs. These programs had never been done before, so funding was not readily available. And thus we raised 80% of our funding from nonprofit endowments, foundations, donors, and corporations. Next slide. And as a result of that, over the years, this is what we've developed since I have been here, and the programs have been involved largely in the last almost 10 years. On the left column, you can see what we've done for the general veteran population. Again, all of these services are free. We provide employment to make sure veterans are not underemployed. We do veteran peer outreach in Orange County to make sure any veteran who's at risk for mental health, homelessness, suicide is addressed by going through all their agencies, their senior centers, every agency we can get a hold of. We do education and outreach, case management. Aftercare, we're working with veterans that were newly housed. Women veterans on point, again, a high-risk population that specifically focuses on providing mental health. And student veterans, lastly, with Outside the Wire, which is on 12 community college campuses in Los Angeles and Orange County. Next slide. I want to focus just specifically on that program, Outside the Wire, because in effect, this program has not only changed lives and helped veterans stay in school, it has saved lives. And I've heard many stories from the veterans in the programs. Initially, all of our programs were funded by nonprofit foundations or endowments, which allowed us to go to a few schools. Orange County picked up some of the foundation of the funding in the last couple of years for this program, which allowed us to expand and stabilize the program. But once the Prop 1 passed, that program was threatened to be not unfunded with the rest of its contract. But the bulk of the program is really keyed on mitigating the access issue to mental health. For most of us, reaching out for mental health is a significant issue that we don't usually cross if a barrier shows up. Multiply that times 10 for the veteran population, which is taught to take care of their own issues themselves. So by putting therapists as well as training the next level of clinician interns right in the veteran resource centers, we mitigate the access issues. Veterans can go without appointments to mental health without too much of a wait, usually the same day, often 24 hours to get the mental health support they need. And as I mentioned, I've had veterans come up and say, not only help me stay in school, there are over 55,000 in California community colleges. We're only in Orange County and LA, but when I presented this at statewide conferences, the question always is, how do we get that program? I said, you have to procure the funding to get that program, and I'll teach you everything we know and how to develop it. Next slide. Let me finish just with a little bit about our impact and what we've been able to do. Next slide. So roughly, these are figures from our 2023 fiscal year. We haven't finished up 2024 yet, but you can see through Women Vets on Point, Outside the Wire, we provided over 3,000 mental health counseling sessions, all for free at no cost. Many of them were virtual during the pandemic. We've done outreach in every corner of Orange County and now have become a service center down there, place people in jobs, train people to be peer advocates, and help people stay housed. All of it is mental health, mental health. Next slide. Finally, what we've done with the state is gotten together annually, and this isn't in a contract of any sort, just to make sure we're working with CalVet, CalTAP, the Veterans Crisis Line, Orange County, and LA to make sure that we have a veteran suicide prevention conference at least once a year, but often we'll speak at others. Final slide. So I just want to thank you. I know that coming together today, I want to thank you for the opportunity. I know that as we work together to continue to fund programs that are innovative and can lead to better outcomes ahead of the curve, can stop our veterans from becoming homeless instead of ending just at the part where they're homeless and picking up. We need to address the issue from both sides, and together we can find a success. Last slide. I'll just thank you, and that's my contact information. And with that, I'll pass it back to Kayla. Thank you.
Thank you all. Toby, Akilah, and Robert, do you have any additional comments before we take any questions attendees might have?
Happy to jump to questions, and I'm having trouble opening my, there we go.
All good. Okay, attendees, if you have any questions, please enter them in the Q&A feature. It's at the bottom near the chat.
Kayla, I'll open up if nothing is. Toby, one of the linchpins and key pieces in Prop 1 mental health service, the mental health services side, and Akilah as well, since you have experience with this, but the full service partnerships that are a key component. If you could expound on that a bit. I know it's an extraordinarily complex topic, so we could probably do a webinar on that alone, but how the FSPs are functioning today and how that is going to change as we move forward, because a vast amount of this money is going to be filtered through the FSPs, the full service partnerships.
Yeah, thank you. So Appreciate that reminder, Chuck. So full service partnerships were designed some 25 years ago to be and it's in the name, that a partnership between an individual who is struggling with significant mental health needs, often as a result of those struggles and inadequate access to services, has experienced homelessness, justice involvement, or repeat hospitalizations. So these are folks who have some pretty significant needs, and we know there are veterans that reflect those realities, right? Significant needs and difficulty accessing effective care. Full service partnerships are a partnership between the individual and a service provider. And that's the partnership part. And the full service is that the dollars can be used to tailor an intervention to support that individual's unique needs in a way that is integrated. And that includes being able to support housing. And, going back 25 years ago, the evidence shows that when you actually sit down with someone and have a conversation about what their needs are and what their goals are, and you design an intervention around them, often with lots of family and community support, depending on where that person is, that you can move people quickly into recovery and support their ability to get a job, keep a job, secure housing, keep housing, and so forth. The Mental Health Services Act has long prioritized using available resources to support full service partnerships. Over the last 20 years, though, we've seen sort of a sliding backwards, moving away from program designs that start with the discussions with the individual around what their needs are, and that have moved towards pulling down federal Medicaid spending under Medi-Cal. And we know that Medi-Cal does not pay for all of the needs that has resulted in a person struggling with housing or addiction or whatever those challenges happen to be. So the commission is working with the Department of Healthcare Services and with the governor's office and the legislature to better understand how we can sort of swing the full service partnership initiative back towards a strategy that is really founded in the needs of individuals and is responsive in that way, while continuing the very important opportunity to maximize the drawdown of federal funding, as well as other potential sources of funding. One of the questions we're sort of working through ourselves at the commission, that we've raised this question with CAVSA, we're talking with some of our legislative partners, is can and should we be thinking about full service partnerships that are tailored to the unique needs of veterans? Some full service partnerships recognize that folks who have a long history of criminal justice involvement have some unique needs. So there are specialized FSPs for what we call forensic FSPs. And that suggests that California can invest in strategies for veterans FSP. So again, it's the conversation we're having. We want to recognize that the idea of tailoring in an FSP very much applies to veterans. We also want to recognize that if we're going to get better at this, it can be helpful to build learning collaboratives and learning communities. And so those sort of specialized veterans FSPs, if we can stand them up, can really benefit not just from learning what's happening in other full service partnership investments and programs, but tap into the long history of services from community-based organizations that are part of CAVSA and others, so that we get it right. We haven't, that is not happening yet. It's early conversations that we're having with our counterparts in the legislature, internal. We are required to do a report to the legislature towards the end of this year. We're thinking through the sort of array of components that are necessary in a strategic initiative to strengthen our full service partnership strategy that recognizes workforce, funding, public awareness and understanding, access, even the ability for step-down care for folks who may need a higher level of service for a period of time, but they can step down to a lower level of care. The very early pilots that were done in the late 1990s actually were successful in working with people who had a long history of state hospitalization and moving them into independence. And so we're very excited that those tools can if we can bring those tools to the veterans community at the same time. Thanks, Chuck.
Thank you, Toby, very much. I do see two questions in Q&A, Kayla.
Yes, okay, the first one is about but I'm going to give a little bit of background about CAVSA that will help with this. So CAVSA is a consortium of 6 veteran service agencies that pretty much cover the entire state of California. But Robert, the question is, what exactly is your service area for U.S.VETS?
Oh, thank you. Yeah, thanks for the question. So we started out in downtown Los Angeles, so it's all of LA County, about 11 million people, and a good portion of them being veterans, I think around 260,000 veterans. So currently, we are also in Orange County. We expanded a second service center to go ahead and develop a similar effort there. And that largely was a result of Orange County being willing to use some of their MHSOAC dollars to make sure we could do prevention and early intervention. So currently we cover all of Orange County and Los Angeles County, those 2 areas. We'd love to expand. Every time I've spoken about the program on community college campuses for prevention and early intervention, San Diego would like to learn more about it. So I'm going to let Akilah take that one over. And also other parts of California, there are schools, again, 55,000 student veterans across the state.
Thanks for that, Robert. All right, we're actually, to stay on time, we're going to move to panel 2. I'm going to pass it to Amy Fairweather from Swords to Plowshares. Thanks, Amy.
Kayla, there was one other question in there. And that question was, do mental health experts and leadership here in California feel psychedelics are a necessary tool to add to the mental health toolbox for veterans?
Toby, do you want to take that one?
Sure. I mean, I want to put that in the context of California developing a research strategy to understand sort of, what's in our toolbox now and the limitations of the impact and the kinds of opportunities we have to add new tools to that toolbox, right? We don't have time to sort of get into what's happening in psychedelics, but, clearly, California needs to be thinking about how we can understand what kind of opportunities are out there, including psychedelics, and then make some specific decisions about, where to invest and what to invest in.
Thanks, Toby. All right, Amy, the floor is yours.
Okay. So I'm going to talk about mental health in the housing context. My name is Amy Fairweather. I'm with Swords to Plowshares. We, along with all of our CAVSA partners, do some similar services, providing permanent supportive housing, and other services to veterans. And we happen to be in the San Francisco Bay Area. All of our houses is in San Francisco, but we provide services in Oakland as well, in Alameda County and the outlying counties. So Prop 1 included $1.065 billion with a B dollars for a bond measure for housing investments for veterans, and particularly veterans who have mental health, behavioral health, substance use needs, or a history of chronic homelessness. That is fantastic. We don't know right now how exactly the rules are going to roll out, the NOFAs are going to roll out, but if it follows some of the history of VHHP that Steve talked about, that really prioritized housing sites that were married to and coupled with supportive services, and more than that, culturally competent supportive services for veterans. And this is just essential because we can build the most beautiful housing, we can build hundreds of thousands of units, but if they are just a key and a door, it's not going to do it. Then we are warehousing veterans in beautiful new buildings. And that's the last thing that we want to do. I also want to add that this is a very vulnerable population, and a population that a lot of people don't understand. There are assumptions that the VA pays for everything. Even the VASH vouchers, which are like Section 8 for veterans. They come with some VA case management, but not those day-to-day services, not those supportive services that these veterans, particularly those who live in project-based permanent supportive housing, need. These are aging veterans. These are veterans with multiple disabilities, mental health disabilities, physical disabilities, aging, high acuity, and importantly, the experience of chronic homelessness, which can add 20 years onto someone's chronological age, the wear and tear on their bodies and their minds. So we know that we need to have those services attached, and there's nothing guaranteed in the Behavioral Health Act, the dollars that are not one-time bond dollars, but continuing funding through the tax, that any of those will go to veterans. And that's not going to work. So we really need to have, the political will to continue some of the pilot programs that have been started in the state of California. And I'm going to talk about the Veteran Supportive Services for Self-Reliance grants that we are responsible for the design of the program, the process evaluation, and the technical assistance, called VSSR. So this was to add extra service staff in permanent supportive housing for veterans, for aging and high acuity veterans within those sites. So not everyone, but those who really need that extra help. The governor very generously recognized this need and made a one-time investment for a 3-year pilot. And this adds support staff on site that can engage with the veterans, that can become a part of the community, break down isolation, and get that trust going that is so important for people to be attached to services, to come out of their rooms, to engage in preventative health maintenance, and to prevent discharges from this housing based on either evictions due to behavioral health, hoarding, substance use, that you can sort of stabilize people, or hopefully to at least, mitigate some of the health issues that would call for someone to have to move to skilled nursing or higher level of care. There really isn't much in the way of that for our veterans, especially these veterans who are so vulnerable and because of their past and their mental health issues. There's no such thing anymore as board and care. The state of California has, the wonderful nursing homes. There's, I think, maybe 3,000 beds, not nearly enough, and also not necessarily appropriate for these residents who are struggling with a lot of mental health need. So what we need is our partners in the state of California to look at sustainable, continual funding streams that will be dedicated to help these veterans in the housing and out of the housing, and all of the wonderful programs that Akilah and my partners Robert talked about. And as I said again, there's not, the bonds are one time. It's bricks and mortar. There's no sustainable service funding so that we can build these programs so we can have the staff. Finally, right now I am in Los Angeles. Normally I work in San Francisco, but as the process evaluator and design consultant for the VSSR, we are conducting site visits. So I happen to be at my wonderful partner's U.S.VETS housing site in Inglewood, California right now. I was at their Long Beach site yesterday. These are sites that have been chosen to have the pilot programs. And so I'm visiting with the veterans and also the staff, the service assistants, the peer specialists, the mental health specialists, and it's really terrific. But I do want to say that I've been sitting in the community rooms, and it takes very little time for you to open your eyes and see these wonderful veterans, just how frail they are. These are older veterans, many with mobility issues, on top of mental health issues and substance use issues, and the long-term homelessness that they have suffered with. So I think that at this point, unless I okay, I'm sorry. See, I'm aging myself. So I'm going to turn it over to Chris Johnson, and then really happy to talk about the questions, about the disconnect between the availability of services, the drawbacks with the eligibility requirements for VA services, and the capacity issues that really don't meet the needs of these veterans. But I hope that, you know, those who are listening, who are in government, and those who are allies and supporters, will really advocate for permanent funding streams for our veterans in housing. And with that, I'm going to turn it over to Chris Johnson from Nation's Finest. I see.
Hi, it's not letting me show you my lovely face.
Oh, Kayla has
here
to
it
fix
goes.
that.
Here we go. There we
All
are.
right.
Thank you very, very much. I take back the lovely face comment then now that you can see me. I'm Chris Johnson, and I'm very humbled and honored to be the president CEO of Nation's Finest, who celebrated its 52nd year this year. My predecessor, some of you may know, Peter Cameron, was with us for 47 and a half years. And he was a Vietnam veteran himself, and wanted to step up and get things done. And very proudly, we have done so for 52 years, 13 regions we serve, 31 locations. Basically, following Amy, anything north of San Francisco, all the way to the Oregon border and east to Nevada, we focus on rural Californians. And as I'm sure most of you are aware, per capita, there are more veterans per community per capita. And the regional is a unique challenge because the VA doesn't have facilities everywhere. So my predecessor said, let's take that on because the veteran need is great in those communities. And in fact, some cases even greater than others because people are looking to get away from populated areas and go to the more regional outlets. We also operate a organization called Veterans Housing Development Corporation that is actually building communities as well. So we're very honored and proud. And one thing I'd like to offer, first of all, please take advantage of the folks that are from CAVSA that are on this call, and please go visit the facilities that they've been talking about. Because it's as was just said by Amy, when you go out and you see not only the staff who are so passionate about what they do, but also the veterans we serve, and you see just the look on their face as change is coming to them, and the look on their face showing that this is some support that they've earned and deserve, and we're very, very proud to give it to them. But I'd also like to offer, since we do have facilities in Sacramento, if you wanted to take staff to Mather Veterans Village, please do, because it's a great example. Phase 1, 2, and 3 are there of showcasing transitional housing as well as permanent housing, and phase 4 and 5 are coming, and that's going to be senior housing and women and families. And so there's a lot of stuff happening. I want to talk a little bit, and everybody's talked about it, but the importance of what we call wraparound services. It would be very presumptive of us to assume we know everything that somebody needs when they come into us and seek support, or if our outreach specialists and peer counselors are out there in the community talking. So the value and what's been talked about with full service partnerships and Prop 1, et cetera, is that veteran-driven need for services and not having a complete awareness from day one of what those services might be. And it's critically important that we all work together to provide that complete wraparound care. And that's what the CAVSA agencies have been doing for as long as we've been around. And that's where the service agencies provide such value, because We work with the communities, we work with the counties, we work with the cities, we work with the mental health professionals, we work with anybody to provide that need. And what I wanted to tell you an example, when COVID hit, we were all told we needed to shelter in place. Well, if you're a veteran sleeping along a river, that's not something that is really possible. And so we as an organization decided, let's create some mobile support. And it proved to be very, very popular to have our mobile service units actually go out there to provide telehealth in the field. And they've become very popular. We have 3 currently, and we're looking to grow that system. But you can drive 3 hours out into rural California and have a meeting where they can actually sit down and have a conference call with a mental health professional, a behavioral health professional, or even a family member, and bring things together. And so what I love most, and just to brag about CAVSA a little bit, what I enjoy most about CAVSA is, as witnessed by the people that have talked on this call, the diversity of ideas, the diversity of challenges that we all face, and the ability to get together and share ideas and share knowledge on a regular basis ensures that not only the veterans that have earned that support get things, but we bring new knowledge to the communities we serve, and that helps the community at large, whether it's businesses, whether it's the the programs that are also supporting homeless in the community. Our focus happens to be veterans. Why? As has been said by everybody, they have unique and different challenges, and in some cases more acute challenges than some of the other homeless that are out on the street. And that's why the wraparound support services of agencies such as ours are important. I wanted to kind of leave with just a couple stories if I can. We've been talking about the folks we serve, but I wanted to give you a couple examples. I call it my medicine, what I deal with every day. We have a gentleman who unfortunately passed away a few months ago named Ken. And when we opened Windsor Veterans Village, he was there as part of the grand opening. Very kept to himself, hunched over, looking down, no lack of confidence, had actually been living on the street for quite a few years. Came up, introduced himself to me, very quiet, very reserved. Went out there a year later. Ken was now known as the mayor of Windsor Veterans Village. He was very active, very vibrant, and he wanted me to come to his home, as he called it, and show it off to me, to demonstrate some of the artwork that he had done, to showcase his family to me. And he started to cry to say that it was the first time in 10 years he's been able to have a home for his grandkids to come visit. And the part that I find really rewarding for myself and our team is, unfortunately, Ken had the need to be put on hospice care. And they were going to put him in a facility, and Ken said, no, I want to have hospice care in my home. Well, the home that he wanted to have hospice care in was Windsor Veterans Village. That was where he felt his family was and the connection was with the community. Without those wraparound care and wraparound services, that would not have been possible. So that's important. Finally, Jane lived in a car for 2 years, in and out. Recidivism happens a lot in our community, and we stuck with her. And Jane not only got her help with transitional housing and behavioral health, she also now owns a home. And so the services rendered by the people you see around this conference call and the support that Prop 1 can provide, I can just say from Nation's Finest standpoint, and I don't want to speak for all of CAVSA, but I'll say it, we're looking forward to working with our counties, to working with Toby and MHSOAC. I want to make sure I get close to saying that correctly, Toby, and all of our other agencies to make sure they get the wraparound care they need. And I'm looking forward to full service partnerships, giving the flexibility that's necessary for us to put the teams together to provide all of that. And with that, I'll hand it back to Akilah.
Thank you, Chris. Those stories are so important. All right, I'm going to open it up for some Q&A. If anyone has any additional questions for Chris, Amy, or Akilah, Toby, or Robert, Please go ahead and add those in. Chuck, do you have anything else, any comments?
I would just quickly ask Amy, I know we don't know exactly, but the timing for the rollout of the Veterans Housing Bonds. I know we've had some conversations with the California Department of Veterans Affairs. What's our fundamental understanding about what we'll be looking at from them?
Well, they already rolled out some of the NOFAs for the non-veteran housing for the I think it's like residential residential treatment dollars. So in talking to folks, I think, let's see, it's July now. Maybe in like October or, in the fall, those will roll out. And again, I hope that they, on the one hand, include the scoring requirements that you have to show that you can provide through partnerships or through the providers like U.S.VETS and Swords to Plowshares and Veterans Village in San Diego and Nation's Finest, that there will be mental health supports, peer supports, to help these veterans be, stably retain housing. And for many, as Chris said, this is going to be their last home, and it is their home. And we want it to be a safe, vibrant place where they can thrive. Yeah.
I do not see any other questions in the chat. Got a couple of minutes yet. Any other questions from the other panelists that you might pop into your head here for the last, and then I could do a close? Okay.
If I could, Chuck, if I could make a plug. So one of the reforms in Prop 1 is to expand the membership of the California Behavioral Health Services Oversight and Accountability Commission. We're actually hoping we can just use an informal name, California Behavioral Health Commission. And there is a seat for a veteran. But more importantly, there are seats for people with lived experience, either mental health or substance use disorders. So, strongly encourage people who are interested to go to the governor's website, gov.ca.gov, and click on the appointments link. And there's a process, there's information there about how to apply. It's very important to us that this commission be reflective of the communities we serve. And if people are interested in applying, recognize that you can qualify for more than one seat. And so the governor's office, their appointment sheet has been very clear that they're hoping to have a robust candidate pool that they can review to make appointments to this commission as soon as January. So that process is open now. I'm more than happy to answer questions. Our website is MHSOAC.ca.gov, and there's a generic mailbox in there, which is the best way to get an answer because lots of people check it rather than just me personally. But questions also can go to the appointments unit at the governor's office. On the funding issue, I don't know dates, but I can tell you there's a lot of people working hard to figure out how to implement this important program, particularly recognizing the timelines for moving from dollars to housing. And so I know that there's an exceptional level of urgency on the governor's side and in housing community development, some of these other departments, to get those announcements out in ways that are supportive. So again, thanks for the chance to join you today.
Well, with that, I will grab the mic for a moment. I want to thank all of the panelists. Toby, the MHSOAC, soon to be the BHSOAC, has been very supportive in this webinar. would not be possible without the support of that agency. Also want to thank all of you participants who took an hour out of your day to listen to our webinar today. I would again say that if there is one single takeaway here, one, we are very grateful to the legislature and the governor's office for the effort that they've made in getting Proposition 1 on the ballot. We are looking forward to working with the local agencies, the local governments, the legislature and the governor's office as they implement over the next, I would say, 1.5 to 2 years. And we would encourage you participants to also engage. And I would simply close with, if you're interested in receiving follow-up information from CAVSA, we are going to be very active this year. We've got an annual report that will come out in November on the status of veterans' mental health in California. And please join us, get on our mailing list. You can reach out to Akilah, whose email address is now on the screen, and we will add you to our mailing list and keep you posted as we progress through the year. Again, thank you all for your participation. And Akilah, if there's anything else, go ahead and you can close the webinar.
Thanks so much. Yeah, please feel free to reach out to me, Kayla@devobergroup.com, and I can help connect you with any of our panelists and get you the information you need. Thanks again for joining. Have a great day.
Thank you.